of the most basic goals in Chinese medicine is to ensure a smooth and steady flow of qi through all the various meridians of the body, especially the primary meridians. In the context of this course, the goal of treatment is to create a well-balanced physical condition that facilitates ease in movement, which enables optimal performance. There are obvious relationships between the various meridians and the parts of the body those meridians pass through. Each type of meridian affects not only an area of the body, but certain layers of the body, as well as the substances and the tissues found there. The primary meridians, along with the sinew meridians and 8 extraordinary vessels, affect our ability to move our torso and extremities in certain ways. In his book, Sports Acupuncture, Dr. Mukaino Yoshito discusses how to diagnose and treat injuries and dysfunction by examining how the patient responds to various movements. Specifically, does a particular movement of the torso or an extremity recreate stiffness, fatigue, weakness, restriction, or pain? These movements assess the condition of the chain of muscles, joints, and other tissues related to the primary meridians, and to some extent the 8 extraordinary meridians, based on the trajectory of each meridian as it flows through the body. We can then influence the well-being and proper functioning of the whole body by stimulating appropriate points along these meridians. In these segments, we will introduce a simple method for checking the condition of the patient's body with movements that stretch the primary meridians. This will enable us to not only treat injuries, but also enhance conditioning and performance before the patient is injured and in pain. So here's the basic approach. The primary and 8 extraordinary meridians are stretched in specific ways to analyze the patient's movements. Each of these movements activates a chain of muscles that relate to specific meridians. We won't go into identifying all the muscles involved right now, but focus on identifying which meridians are imbalanced. We'll discuss the muscle involvement specifically later on as we cover each section of the body. It's worth noting that these tests determine which anatomical aspect of the body requires treatment and the meridians corresponding to that aspect. The 3 aspects of the body are the anterior, posterior, and medial lateral. From a 5-element perspective, the anterior aspect is governed by the metal and earth elements, and from a 6th division perspective, the anterior is governed by the Tai Yin and Yang Ming. The posterior is governed by the sovereign fire and water elements, and also governed by the Xiao Yin and Tai Yang. The medial lateral aspect is governed by the ministerial fire, that's the triple heater and pericardium, and the wood elements. And from a 6th division perspective, the medial lateral is governed by the Jui Yin and Xiao Yang. Looking at it from the 8 extraordinary vessels, as you'd expect, the anterior is governed by the conception vessel, the posterior is governed by the governing vessel, and the medial lateral is, of course, governed by Dai Mai. There are 30 total meridian stretches involving the torso, the head and neck, the arms and hands, and the legs and feet, and we will review the basic ones in these video segments. Okay, so we're going to start assessing the primary meridian movements through some various stretches with the help of our model Pete here. Thank you for coming in.
Of course, happy to be here.
All right, so the first section we'll do involves the neck. And so we're going to be accessing and assessing the primary meridians of the lung, the large intestine, and by association the conception vessel. So the first stretch is simply to extend the head back, so just look up towards the ceiling slowly. All right, and any tension in the neck here?
A little bit.
A little bit. Okay, and bring that down. Okay, and just look straight ahead, like you would normally. There you go. All right, so that extension stretch tests the lung and the large intestine, especially around the sternocleidomastoid muscles and the various muscles in the front of the neck. Okay, and the next you'll just simply look to your left as far as you can, and then look to your right as far as you can, and then look straight ahead. Any tension or stiffness?
Inside, yeah.
A little bit? Okay. So that also, interestingly enough, despite it being a rotational movement, and we'll get to this later when we talk about the sinew meridians, but in this case, this type of movement, this lateral rotation, will assess the condition of the lung and large intestine primary channels as well. Okay? All right, so the next one, you'll simply bring your chin to your chest, and stretch down, and then bring that back up. Okay. And that is going to assess the heart and small intestine primary channels. And then, as easily as you can, bring your right ear to your right shoulder, and then the left to the left, as far as it's comfortable, and then back up. Okay, any pain or discomfort?
Yeah, a little bit.
A little bit. Where'd you feel it?
Right down here, going into the trap.
Okay, right. So this is, interestingly enough, Pete was pointing to the triple heater meridian, and this actually assesses the pericardium and triple heater primary channels, and also by association to some degree the diaphragm. Okay, so the next 8 movements will assess the arms, utilize the meridians going through the arms. The first 2 will be for the lung and large intestine. The second 2 will be for the heart and the small intestine, and the last 4 will involve the pericardium and triple heater. So the first one will be simply an extension, so you have your patient extend their arm out, and in this regard, in this test, you want the palm to be facing downward. So you can assist the patient a little bit, you can support their shoulder, and see how is that? Any discomfort there? All right. And then you can try it with the other side. Just bring that out. And then back a little bit. All right. Okay. And so this is going to be dealing with primarily the large intestine and the lung channels. All right. The other one that's going to involve the large intestine and the lung will be internal rotation. So we have the patient put their arm out like this, elbow gently locked, and then simply internally rotate the shoulder and the elbow to whatever degree is comfortable. How's that? Is that all right? Okay. And this internal rotation also is going to test the primary channel of the large intestine as well as the lung. And of course, by association, the CV. Even though that the conception vessel, and we'll get to this a little bit, even though the conception vessel and the governor vessel and the diaphragm, of course, don't run through the extremities, there's the chain of muscles that attach to the torso that involve muscles along these 8 extraordinary vessels. So these are 2 tests for the large intestine and the lung channel. The first, again, is extension, and then the second is internal rotation, as far as it's comfortable. Okay. So the second 2 are going to involve the heart and the small intestine, and by association the governor vessel. And this is simply arm and shoulder flexion, so you help the patient bring their arm up as far as they can go. Any discomfort there?
Just tightness.
Okay. And then one more time, I'm going to do it with the elbow just a little bit more straight. You can just push a little bit against the resistance there. Any discomfort there? Okay. So this is for the heart and the small intestine channels. The second one is now external rotation. So this is the complement, the yin-yang complement of the lung and large intestine. So we'll bring the elbow and shoulder out, supinate the hand into external rotation. Any discomfort there?
No.
All right. And so that's the second of the ones that assess the large, the small intestine and the heart. And the last 4 will involve the pericardium and triple heater. So the first is horizontal flexion, which is you bring the arm across the body. You can support the patient from the back if you want, and just push to the end range. How is that, okay?
Yeah.
Okay, and then you can try that for the opposite side as well. There we go. It's always good to assess both limbs, even if the problem is only in one limb, because you want to be able to compare how one side is with the other, how the affected side is with the non-affected side. Interestingly enough, what you'll often find is if there's a pain or discomfort or some kind of stiffness or issue involving one side, even though that the patient may not be feeling it on the other side, oftentimes you'll see some inhibition in the range of motion as well, but not always pain. All right, and so the second one is elbow flexion. So you're simply bringing the arm up as far as comfortable, and then bringing it back down. Any discomfort there? Okay. And the second one is now going to be horizontal extension. So you help the patient bring the arm out as far as is comfortable. I like to support the shoulder. All right. Any discomfort there or stiffness?
Just stiff, restricted.
Just stiff. And where did you feel that one?
Mostly coming down the arm.
Okay, and interestingly enough, he's tracing the heart channel. All right, and so the last one will be simply elbow extension. So you can start from here and then have them bring the elbow back down and out, like that, just a little bit. Any discomfort there?
No.
All right, and again, you want to test both sides. Okay, so now we're going to do a few assessments that are going to be involving the wrist. So the first one's very simple, and this is called ulnar flexion. Ulnar flexion. And so make a sort of blade edge, okay? And then I like to support the wrist a little bit, and then bring the hand down as far as is comfortable. It's good also to look at the patient's face, so if they're starting to grimace, you know that they're in pain, so you should stop pushing. All right, so I'm just going to extend this way a little bit. All right, so that's ulnar flexion, and that's going to be assessing the large intestine and lung primary meridians as it moves through the wrist. Okay, and then the next one is radial flexion, so just bringing the arm up, again supporting the wrist, all right, bringing it up like this. Any discomfort there? No. All right, and this assesses the heart and the small intestine primary meridians. All right, and the next one, and again, you want to be very gentle with these, all right? So you want to support the wrist, and we're going to bring the wrist up like this into wrist flexion. And I generally like to just, ease into it a little bit, not just one complete motion into, that full flexion, because that can injure the patient, especially if they're already sore. That's okay? Mm-hmm. Okay, and so this is going to assess the pericardium and triple heater primary meridians. In particular with this one, more so the triple heater, obviously, because that's the one that's being stretched the most. And then obviously the yin-yang complement to that is the wrist extension. So again, supporting the wrist very gently, bringing this down, looking at the patient. Any problem there? No. And again, this also assesses the pericardium and triple heater primary meridians. And obviously in this stretch, we're putting more of the stretch on the pericardium. So the next two that we're going to assess are going to involve the stomach channel and the spleen channel, and by association the CV. So the first is called hip extension. So you want to support the patient at the ankle, and then you want to bring the leg up and the knee up like this. All right, how's that?
Not bad.
All right. You don't really want to pass 45 degrees, or maybe 90 degrees, I guess, with the leg here like this. So you don't want to bring the knee back like this and then lift it up. You really want to keep a little bit of an angle, so when you're lifting like this, it doesn't put too much strain on the hip. Okay. Any pain or discomfort there?
Not much.
Okay. And then one of the things that I like to do is, on the second go-round, is provide minimal lift and actually ask the patient to bring their knee up off the table. So good, bring your knee up off the table. So I'm just really guiding, he's holding his own weight. And bring that up as much as you can. How's that? Is that all right? Mm-hmm. Okay. And then I like to help the patient bring the leg down so it doesn't just drop to the table. So the next one is called knee flexion, and that's very simple. Just bringing the knee up as close and as far as you can go. How's that? Okay? Mm-hmm. All right. And then the second time, I like to actually have the patient do it themselves and just guide. So bring the knee up as far back as you can. And then back down. Okay. And again, that's going to assess the spleen and the stomach, and by association, the conception vessels. So these next two are going to assess the bladder channel and the kidney primary channel, and by association, the governing vessel. So the first one is simple flexion, hip flexion. So we're going to bring the patient's leg up as far as is comfortable. About there is good? Okay. And then the second time, I actually want to have him do most of the lifting himself with his own power, and I just guide, just to the point of discomfort, if there's any. All right, we'll bring that leg down. So, one word of caution: if your patient is dealing with a suspected bulging disc or a low back injury that might be involving the nerve root, you want to be very careful when you do this test. And so as you're bringing it up, like let's say Pete came in, he said, I strained my back. I haven't been to the doctor yet, but it's in a lot of pain, and I get radiating pain down the leg. That's going to be your key red flag when you're doing this test. because as you'll find out in another part of the course, in another video, there's something called the straight leg raise, which is basically this very movement. So if somebody has a bulging disc, or even worse, a ruptured disc, they're going to start to feel pain somewhere around the 30 to 35 degree range. So you want to always do this very slowly, and you want to make sure you're looking at the patient's face in case they're showing signs of distress or discomfort. So in case of a low back injury or a strain or a sprain, even if it's something minor, like, oh, I was lifting something out of the trunk of my car and I felt this twinge, you want to be very careful doing this test. And by careful, I mean just moving slowly and paying very close attention, right? So if somebody has a ruptured disc, they're going to start to feel it about here. If somebody has a bulging disc that's not too severe, they'll probably be able to make it up to about here. And then again, if it's just a strain or a muscle ache, right, nothing too severe, maybe even a sprain, a slight sprain, they can probably come up to about 70 degrees. All right. The second one is going to be hip and knee flexion together. So you're going to support the leg. I like to kind of come under the ankle and under the knee, and basically just bringing the leg up like this. Any discomfort? Okay. Now in this test, you can also hook their foot under, with inside of your arm here, and that gives you a little bit of extra push, because you don't want to be pushing with your muscles. Really letting your body weight do the work as you lean, right? Okay. No discomfort there?
Just tightness in the hip flexor.
Just tightness in the hip flexor. That's not uncommon. Also with the leg flexion, a lot of folks, especially as we get older, the hamstrings are going to get a little more tight. So the discomfort that people may feel, you want to make sure you ask them where they feel it. So it's specific, because a lot of times if you lift this up, and they say, oh, that really hurts, you may assume it's something going on in the low back, when actually it just may be a tight hamstring. So these next three movements are going to assess the gallbladder, liver, and by extension the diamine. So the first is called lateral rotation. So you simply assist the patient in bringing their heel or their inside of their foot to their knee. And if they have trouble doing that, you can bring it against the table. Right? If they're more flexible, you can bring it up above the knee. But for some folks, especially older folks who haven't had a lot of exercise, they may not be very limber. And you can support their leg, and you have a hand under their knee, and you simply help them bring the knee out and down. Any discomfort there?
A little bit.
A little bit in the hip?
Yeah.
Okay. So again, as soon as the patient responds with an experience of stiffness or pain, that's when you want to stop. You don't need to go any further. And then I like to do it again a second time if I can. Bring the foot up just a little higher, bring that down, and again just supporting it. Right there? Okay. All right. And then bring the leg back into position. So the next one is adduction. And this can be done with the patient on their back, supine, or on their side. In the beginning, you just simply have them bring one leg over the other into adduction, adduction. Any discomfort there?
We stopped at the pre-time. Yeah.
Okay. All right. And then going the other direction.
We're right about.
Right about there. Okay. And where did you feel that?
IT band and hip.
Right along the IT band and hip, right? Right along the gallbladder meridian. Okay. So the next one is going to be the counterbalance to the adduction, which is abduction or abduction. So you start with the patient's feet fairly close together. And then you support them bringing their leg out. Any discomfort there? Actually, you're very flexible, so that's good. All right. And then I like to have them do this again, mostly under their own power. So I'll guide, but you lift and stretch it out. Any discomfort? Now you can see there's, right about there?
Yeah.
Okay, so we'll bring it back. And you can see there's a natural tendency sometimes as they get close to the end range for the knee to start to bend, because that's going to slacken the muscles in the quadriceps, and that will actually give them a little more stretch, right? Because if you bend the leg like this, you can see how much further you can bring the leg out. So people might cheat a little bit. All right. So the next four that we'll do are going to assess what's happening with the ankle. So the first is going to test the stomach and the spleen channels. The second is going to assess the kidney and the bladder channel. And the last two will assess the gallbladder and liver. So the first is simply plantar flexion. So you're going to actually go ahead and relax your foot. So I'm going to press down first, and then I'm going to have you do it yourself. So I'm just gently going to bring pressure down onto the foot like that, from the toes, very gently. How's that, okay? All right. And then I'll have you do it again yourself. How is that, okay? All right, very good. All right, so that's plantar flexion, and that will assess the stomach and the spleen. The second is dorsiflexion, and this is going to stretch the kidney and the bladder channels. So we're going to, from the toes, but also including the feet, you're going to kind of curl the toes up a little bit, and then bring the foot up as much as is comfortable. Is that okay? All right. And then the second time, I like to have the patient do it themselves. All right. Any discomfort there? Okay. Oftentimes, one of the things you'll see most often in the clinic, especially with people with plantar fasciitis or something with akin to an Achilles heel strain, which they may not know they have, they just feel foot pain, but it could be coming from the Achilles. When you have them do this, they'll feel it right away. So the next two are going to assess the gallbladder and the liver, and again by extension the dymi. And so the first is simply supination. So you're just simply going to bring, pronation, is you're going to bring the foot into an internal rotation like this. All right? And then supination is outwards, like this. Any discomfort there?
The pronation.
On the pronation? All right. Let's have you bring your foot inwards as much as you can. And then I'm just going to add a little bit of a twist this way, just a little bit.
About there.
Okay. And then we'll bring it out, and then again a twist in the other way. A little bit. Okay. All right. So once again, there's several ways of doing that. One is you can actually hold the leg in place and move like the whole foot with your hand. I generally just like to guide with towards the ends, right? Just with a little bit of my hand. Okay. And so that's for the gallbladder, the liver, and by extension the dymi. So for the last four, we're going to be testing the primary meridians that move through the torso. And the first, which is going to assess the spleen and the stomach on the anterior aspect of the body, is simple extension. So we're going to support the patient's low back and have them look up towards the sky. All right. And that's pretty good. All right. Any discomfort there?
Lower back.
Low back. Okay. So we'll get to this later on in the course. So sometimes in a particular stretch that puts tension on the meridians that we're assessing, the patient may actually feel it somewhere else. And so we'll cover that as well. So one more time, one more stretch. And then look up. There we go. And then back up. Any discomfort in the front?
A little bit.
A little bit?
Yeah.
Where did you feel it?
Mostly right.
Okay, right along the stomach primary channel. All right, and so the next one we're going to test and stretch the kidney and bladder channels. So let's have you bend over at the waist and touch your toes if you can. All right. Any discomfort back there?
Yeah, definitely in the back.
Okay, so you want to check in with the patient to make sure they're experiencing if they are experiencing any discomfort, you want to stop the movement about where they feel it, so we don't want to aggravate anything. So let's have you gently do that again, one more time. I like to repeat it sometimes. And go slowly, and then just show me right at the point where you feel the discomfort.
Right about there.
Right there, okay, stop. And then we'll come up a little bit. And now we're going to test a little bit of an oblique movement. And then you're going to touch towards your right toes, actually with both hands. Yeah, okay. And then come back up. And then touch the left toe with both hands. There we go. And then come back up. And you can actually do this with all the movements that we've covered thus far. So again, in the beginning with the extension of the head, you can also have them obliquely move to the left and the right, as well as the wrists and the arms as well. Okay? All right, so that assesses the bladder and kidney primary meridians, as well obviously as the governing vessel. So the next two torso movements we will assess will involve the liver meridian and the gallbladder meridian. The first will be lateral flexion. So simply have the patient put their hand at their sides and keeping their torso straight, have them bring their arm down to stretch the side. as far as is comfortable, no further. All right, and then try the other side. Okay, good, good. All right, bring it back up. Okay, so that's lateral flexion, and that will involve the liver, the gallbladder, as well as the diamine. And the next one will also involve those 3 meridians, and this is simply rotation. So keeping the feet planted, and at the waist, simply have the patient twist as far as is comfortable, and then back the other way. Any discomfort there?
Yeah, look for the obliques.
Okay. Interestingly enough, and you'll learn this more in the course, the internal oblique is, the motor point is liver 13, and the motor point for the external obliques is gallbladder 26. So you can see how this natural movement would stretch and put stress on these 2 meridians, as well as the diamine, which of course goes through and shares points with the gallbladder meridian. So now we're going to be looking at various manual muscle tests. I'd like to start off with the head and the neck. There's a lot of muscles, especially extensor muscles, in the back of the neck that attach to the head, and they're all so small and close together. It's very difficult to test each one of those individually. So we're going to be looking at the neck extensors as a group, which run all through the back of here. All right, so basically you're going to start with the patient with the arms over the table so they don't recruit the power of their arms, lying prone, and bring your head back a little bit, up a little bit, okay. Now very gently with your palm at the back of their head, somewhere around due 17, and supporting their low back, you're going to have the patient push up and resist against your hand. Push up and resist. I'm going to press down. Okay? And now we're going to test the extensors that are a little bit lower down. So bring your head up even further. And I'm going to press, and you resist, and stop. Okay, you can relax your head. All right. So anytime the patient is pressing against your resistance, you only want to resist it for 1 to 2 seconds. What we're looking for is the feeling of those muscles locking up. This is not a contest of wills. This is not a contest of strength. A lot of your patients will look at it like that, so they're going to really try and push up against your hand in different movements, but they don't need to do that. We're really just testing that first adaptation of those muscle fibers as they're working against an opposing force. So that only needs to be 1 to 2 seconds. So one more time, bring your head up. All right, so we'll start at about level, and then I'll press down, you resist, and it locks up, so that's strong. See, 1 to 2 seconds. Now bring your head up a little further. Okay, now resist, and relax. So his muscles locked up, not in a bad way, it just they engaged. And that's what we're looking for when we test with the manual muscle test. Are these muscle fibers flexible enough and getting enough chi and blood that allow them to engage against that opposing force and hold their position? So now we're going to be looking at the more oblique muscles in the neck extensor group. And so what we'll do is we'll have Pete lift his head up a little bit and then look to your left. So we'll have him turn a little bit. And then I'm going to press here, right? And I'm going to press and you resist. Okay, and then bring it up a little higher, straight up. Okay, and then resist. Okay, and then let's do the other side. Right there is good, and resist. Excellent. Now bring it up just a little higher, and resist. And that's good. Again, anytime we're working with the neck, you want to be very gentle. The line of drive is straight down, but again, it's a very gentle pressure. Now, Pete's, he works out a lot, he's very strong, but not all of your patients are going to have that neck strength. So again, you need to be very gentle when you're applying pressure. Anytime the patient starts to shake, you want to stop the test because the muscles are getting overtired. So that last test, with the torque in the head, that now is going to test the more oblique aspects of the neck extensors. So continuing with the orthopedic evaluations, we're going to start with what's called the foraminal compression test. And like the name suggests, we're going to be testing by compressing the spaces between the vertebrae in the cervicals. And this will put particular emphasis on the lower cervicals, but the upper cervicals will be affected as well. So very simply, we're going to have Pete put his head gently in lateral flexion and placing my hands on top of his head. I'm not going to be pulling down with the weight of my arms, the strength of my arms. I'm really just going to be kind of like leaning a little bit. The line of drive is straight down, but not a lot of pressure. And you just gently like lean into it and let me know if you feel any discomfort.
Just a bit.
Just a little bit? Where do you feel it?
Just about right here.
Right in there. Okay. Did you feel any radiating sensation down into the arms?
No.
Okay. So even if someone has pain or discomfort with this test, that's not necessarily a positive sign. A positive sign is what we call radiculopathy, which is a fancy term for a radiating pain or sensation that goes down across the traps, over the shoulder, and generally into the arm. So that would be a positive foraminal compression test. And you can do that to the other side, so just have you tilt. And again, line of drive is straight down, but you're not pulling hard, you're just pressing down with your weight and then stopping. Any discomfort?
No.
Okay. So again, since I'm behind the patient, I can't see their face, so you want to go very slowly and be very gentle and make sure you let the patient know to let you know if they have any kind of pain or discomfort so you can stop, or if they have any radiating sensation down into the limbs. The next test is called the Jackson's test, which is very similar to the first one. So go ahead and turn your head to the right and look to the right if you can. So the Jackson's test is very similar to the first one, but now we're testing, putting even more pressure on the lower cervicals. And similarly to before, just bringing your weight down. Any discomfort?
No.
Okay. And you would do that on both sides, and that's called the Jackson's test. Again, a positive sign is the radiating sensation down into the limb. Pain is not necessarily a positive sign. The last test is called the Sperling's test, and this is going to be the most intense on the lower cervicals, but again, testing all the cervicals as well, but again, primarily the lower cervicals, basically from 5 to 7. So as before, we're going to have you tilt your head a little bit to the side, but unlike the Jackson's test, we're actually going to also bring it back. So it's lateral flexion and extension simultaneously, and actually you want to test to see if that stimulates any discomfort or any radiating sensation right there. Anything there?
No.
Okay. So if somebody goes into that extension and lateral flexion simultaneously for what's called the Sperling's test, if they experience any of that radiculopathy, right there it's a positive test. You don't need to do the next step. You're good to go. So again, looking back and up and to the side, just gentle pressure straight down. Any discomfort?
No.
Okay, again, you want to do it slowly, very carefully and gently. Okay, again, tilt your head to the side and then look back. And again, gentle pressure straight down. Any discomfort?
No.
All right, very good. So that's called the Sperling's test. So these are successive tests that let me know how the condition is of the cervical spine and the facet joints as well, in particular with the Sperling's test. Not only does it test the foramen and the disc space between the vertebrae, but this also actually gets into the facet joints.